In relation to the Omicron variant specifically, as of 5 p.m. yesterday, there were 696 confirmed cases in Scotland. However, these are cases confirmed through genomic sequencing, and this measure, therefore, very significantly underestimates the true volume of Omicron cases. As I have set out before, an earlier indicator of whether or not a case is Omicron and a better measure of the overall volume of cases is the absence in PCR results of a specific genetic characteristic known as the S gene. Around 95% of all tests that are done in Scotland are analysed in a way that allows us to see if this S gene is present or not. And this has revealed over the past couple of weeks that Omicron cases have been rising exponentially, indeed faster than anything experienced previously in the pandemic. And as you've heard me say, in recent days, cases have been doubling every 2 to 3 days. Now, last Friday, when I stood here, I reported that the S gene indicator was telling us then that 15.5% of all cases were likely to be the Omicron variant. Today, it is 51.4%. So that does mean Omicron has now replaced Delta as the dominant COVID strain circulating in Scotland. And that presents a challenge because we know Omicron is significantly more transmissible than Delta. It has an R number that is possibly above 4, and therefore it is driving, and the bigger the proportion of cases that are Omicron, the more it will drive, or the more it risks driving, a much steeper increase in cases overall. Indeed, cases have already increased in the past week by more than 40%, and we should expect to see that continue and indeed accelerate in the period ahead. The tsunami I warned about a week ago is now starting to hit us. However, and this is a key point, a really key point actually, we shouldn't be fatalistic about this. We are not powerless in the face of it, and I will return later to what we can all do now, individually and collectively, to slow down the spread of Omicron and try to avoid these worst fears that we have right now coming to pass. And slow it down we must, because there is no doubt that as of now, the scale and the immediacy of the challenge it presents is of profound concern. Even if it did turn out to be generally a little bit less severe for most people, and I want to stress again, we still don't know that to be true. For some people, even if that was true, it will still cause serious illness and hospitalisation, and tragically, more people will die. And even if the number of people falling seriously ill is a smaller percentage of cases than with Delta, the basic fact of arithmetic is inescapable. A smaller percentage of a much bigger number of infections will result in a massive number of cases needing hospital care. Indeed, total hospital admissions in Scotland in the week up to the 13th of December were slightly higher than in the week previous, so we're already starting to see an increase as a result of the relatively moderate rise in cases seen in previous weeks. Perhaps more significantly, in London right now, where the number of Omicron cases is currently the highest in the UK, hospital admissions are now rising quite sharply. If we don't act now, what we have feared all along since the very start of this pandemic, but so far managed to avoid the overwhelming of the NHS, could happen. And that is one, not the only, but it is one very important reason why slowing this down matters so much. But it is also important to understand that this is not simply an issue for the health service. The numbers of people becoming infected, even mildly, and having to isolate is already putting a significant strain on the economy and on other critical services. As people become infected, we lose drivers for trains, we lose teachers for classrooms, we lose nurses for hospital wards and workers for businesses, the length and breadth of the country. So there really isn't a choice to be made. There never has been. But right now, there certainly is not a choice to be made between slowing the spread of Omicron and protecting the economy. We will actually only protect the economy if we slow the spread of the virus and reduce the number of people getting infected with it. That said, I realise, I am acutely aware that the steps we're asking people to take just now, particularly that advice to limit social contacts is having a severe economic impact. This is particularly hard on sectors like hospitality and culture. These have been badly affected by previous waves of COVID and the restrictions we've all been living with. And of course, these sectors were hoping, until recently, with some justified optimism for a much better Christmas period ahead. So what has happened in the past 3 weeks has been a cruel blow to everybody, but it has really hit these sectors very hard all over again. That's why we in the Scottish Government have found £100 million to help businesses in these sectors. I can confirm today that 66 million of this will go to the hospitality sector, 8 million will go to the food and drink supply chain affected by hospitality cancellations, and that includes wholesalers. 20 million will go to the culture sector, 3 million to the wedding sector and 3 million to the worst affected parts of tourism, including international inbound operators. We're working with councils, enterprise agencies and others to ensure businesses get this money as soon as possible. Those who've received support previously will be contacted directly, and further details of the funding and how it will be paid are available on the Find Business Support website. The support we are providing is significant, but I know it won't fully compensate these sectors for the impact they're suffering right now. That's why I wrote to the Prime Minister yesterday asking the UK Government to provide the support that is needed. In my view, business now needs the type and scale of financial support available earlier in the pandemic. And the reality is, whether anybody likes it or not, that can only come from the UK Government because it has borrowing powers that the Scottish, Welsh and Northern Irish governments simply do not have. I'll press this point with the Prime Minister when I speak to him later today. I had hoped that I would already have spoken to him by now because we must all realise that with a virus doubling every couple of days, businesses already bleeding, every 24 hours counts. There is no time to waste. So I hope the conversation later will be a positive one and that it will give businesses the assurance of support that they so badly need.